thank you very much for joining and sitting down with me and everything. Could we just get you to do it like a brief introduction of who you are, where you're working, and what you do and how you got there? That's not
Yes,
too many questions.
that's right. So, first of all, yes, thank you again for the opportunity and and for this platform where I can talk about the paper. So I'm a research associate at the Public Health Foundation of India and currently a part of Project Core, which is a large-scale global oral health program. And we are funded by the NIHR and it's spanning across 4 countries, namely India, Brazil, Kenya, and Colombia. And so we are looking at oral health inequities, determinants of oral health, and understanding the community experiences of oral care. Um, as in how I got here is fairly straightforward. So I feel that my journey into research kind of began from my clinical years. After I did my bachelor's in dentistry, during internship, we had to be posted at these public health centers at really remote rural areas of, in and around where my university was. And we used to do dental camps, outreach camps, and we used to conduct screening camps. And I remember handing out toothbrushes to patients that I had just screened for pre-malignant lesions because of tobacco usage. And it felt deeply inadequate, of course. And these kind of experiences, they stay with you. And if I'm going forward from there, I even after practicing privately for around 3 years, I felt okay, it was time to pivot to what the what stayed with me, and I felt like I had to go back to research and probably do something that was on at a personal level maybe more fulfilling. And I went ahead and pursued a master's in global health. And after that, I was fortunate enough to find this role with Project Core, which was very much aligned with, of course, my expertise, what I had studied, and also where I wanted to head forth when it comes to, work and going ahead in research. And the work in Project Core has really, I feel it has helped me understand that oral healthcare gap more meaningfully. It has helped me add more context to what I had seen during my internship. It's
Yeah.
probably what I would say. Yes.
Yeah, and just so empowering to kind of see that gap and acknowledge that and then be able to move in a direction where you can be addressing that instead of just throwing up your hands and well, I guess that's how it is. Yeah. So this particular paper, it's a very interesting one. And so I just would love to hear a little bit about how this idea came up. And so before we get into the details of this paper, what was the motivation for pursuing this type of like critical narrative review on dental reform?
Yes. So I would say, in all honesty, this is less of a new idea. And I would say this is more of a question that has probably been circling in dental public health, and global oral health for some time. And I believe Professor, and especially with seeing the response and the way people are resonating with what we are trying to say, I believe Professor Manu, of course, the researcher that Professor Manu Mathurai probably needs little to no introduction in our field. We have co-authored this paper. I feel that we've just come out and said what many were already thinking, and anyone who's been part of program management meetings or policy consultations and then stepped into a community setting, they see the disconnect. I feel that we've all seen the disconnect, and the language of reform is confident and the frameworks are ambitious, the commitments are stronger than ever, and yet the burden numbers are not moving the way you would expect them to. The motivation was really to take off the blinkers and ask why. Why,
Yeah.
despite decades of policy discourse and stronger than ever global commitment, are we still seeing such a high burden of oral disease? And we are definitely not suggesting that the work that is being done is without value. Of course, we see the impact of every work that we do. But what I felt that we didn't see was like a sustainable shift in how the system was working. And we are asking whether we've been so focused on planning and delivering that we've probably forgotten to stop and check how much of it is actually reaching the people that it was meant for.
Yeah, and it's interesting you say that. Obviously, you've got a great response from this, and everyone is saying you're saying what we're all thinking, and yeah,
Yes,
that you've been
yes.
able to pinpoint. Well, someone needs to actually say it then, so we can do something about it. Okay, so firstly,
Absolutely.
just in simple terms, you've got lots of like kind of high level frameworks and things like that. But just overall, what are you trying to say with this article?
Um, so, of course, this was like a critical narrative review, where we looked at the global dental reforms and then we kind of categorized into four dominant directions. And what we noticed was that they were all running into fundamentally the same problem, right? And they each hold genuine promise, but they're not embedded within the health systems, and they're not designed with the sufficient context of the communities that they were meant to serve. And these drawbacks that we came across, they were different in shape but then strikingly similar in origin. And so, but beyond diagnosing that, what we are really offering with the paper is a lens, I would say. And there is a well-known saying, I do not know who quoted this, but a problem well defined is a problem half solved. So the paper is largely an attempt to define the problem more honestly. And of course, in that attempt, through extensive reading, we came across epistemic humility and implementation realism. And we felt that oral health reform needed both and maybe something further. And what we are proposing with epidemiological humility, it's not a tool or a formal framework per se. It is closer to a school of thought. We
Mm-hmm.
are asking researchers, policymakers, and practitioners to question whether the data that we have is actually capturing the people who are suffering, and to hold ground reality alongside theory at all times. And the reason we call it epidemiological humility is because data, I feel the data itself is just shaped by who gets counted, right?
Mm-hmm.
Those who are most burdened are often the least visible in that data, especially in countries with low resources. That is another, thing to factor in. And so we're not just asking whether reforms are working, we are asking whether we know the full scale of what we are failing to address, whether we even know, like that's where I'm saying that we're trying to define the problem in a more honest manner. Yes.
Yeah. And so, as a reminder to the people doing the research to also be stopping and having this thought of before you make
Yes.
potentially sweeping generalizations, make sure that the data you're looking at is covering everyone.
Yes.
Yeah,
Yes.
that's very different. So, I was going to talk about next what does it mean matter for equity and what needs to be done next. But I think you just covered that. Like, if we're the whole purpose is equity and ensuring that different populations are all
Yes.
included.
Yes,
Yeah.
actually, if I had to like really put it in very simple terms, because when you look at equity at its core, it's just about being sensitive to context, right? That is what distinguishes it from equality. Equality gives everyone the same thing, and but then equity goes ahead and asks, now what does this person and this community and this setting actually need? And what shapes context? It's not simply the interaction between a provider and a patient. It's where the care is delivered. How is it being delivered? For how long? What kind of care? Under what constraints? With what cultural meaning? And again, context is defined by so many interesting perspectives that I feel that no researcher or policymaker alone can fully know it from the outside. And that is precisely where, I feel that humility here would not just be a virtue. I would probably say that it's a methodological necessity. Like we cannot
Mm.
design for context that we have not genuinely listened to or understood. Right?
Yeah,
That's
it's like we've
probably
skipped
what I
that
would
first
say.
step. Yeah,
Yes.
definitely. Okay. And so, just in a nutshell, this is an important thing for researchers to consider. But how would we convey this to both like policymakers and the public to try and make sure this type of ideology is like translated fully?
Yes.
Or is this just we're pinpointing that the researchers need to be considering this from the get-go?
I would honestly feel with this paper, what I would say is there has to be an important shift in making these conversations genuinely like a two-way conversation. It's more than going from table to community, like having decisions made inside really serious meeting rooms and then hoping that they would work in these communities. I think what we need to do is we need to make these conversations genuinely like two-way conversation. We need the policy makers to tell us what will actually work within their systems. And
Yeah.
I think we need the communities to be telling us what they want, how they want it, and what has failed them, before. And of course, for too long, we all know this. This has been talked about extensively that reform has moved in one direction, from the top down, like from the planning table to the community. And so, if there is one thing I would want anyone to take away from this paper is that the word delivery, I think that comes much later in our process, and it should come much later than it currently does. So before we deliver, I would say that we need to listen, we need to question, we need to understand and adapt. Probably have a plan B, a plan C, and a plan D. All shaped by the reality on the ground. So I would say that delivery should probably be the last step and not like the first instinct. Is what we're trying to tell the people.
Yeah. Okay. Gosh. Okay. So aside from ensuring everyone watching will read this paper and then make it their background and make sure they're thinking about it all the time, is there anything else we haven't covered today that you just wanted to make sure people walk away with?
Um, hmm. I think much of it, yes, it's probably. I'm very happy that much of that is very much covered in the paper. Where we just
Yeah.
hoping that researchers, as experienced as we are and as highly, of course, with the expertise that we have, I just hope that we all arrive with humility. And just hold reality along with theory at all times. That's probably what I would end it with. And I think yes, we've kind of covered almost everything.
Yeah. Okay. Perfect. Well, thank you so much for going through this paper with us. I had a great time reading it and can't wait to incorporate it into my work.
Great. Thank you so much.
Thank
Thank you. Thank
you.
you, Ruby. Thank you for your time.
Thanks.